Good morning, everyone. My name is Marla McGinnis, and I'll be your moderator today for our post-cabinet media availability. We're joined now by the Honourable Tim Houston, Premier of Nova Scotia, who will now take questions from media. Go ahead.
Premier, I'm wondering your thoughts on the letter that you would have received this morning from 39 physicians in the largest ER in the province, suggesting that the plan you laid out yesterday really doesn't solve the problem.
Just became aware of the letter. Obviously, the issues in healthcare are long-standing and complex. There's no question that bed utilization and those types of issues are real issues. But there are many parts of the solutions, and we've certainly heard from lots of emergency room doctors across the province, had positive feedback, I think, from doctors in Nova Scotia. People know that there's a number of steps to be taken here. So great respect for the physicians that sent the letter, and I've asked the team to go and speak with them about their specific concerns, but there's lots more work to be done on this, folks. People know that.
I think that's given. Even the doctors admit that, but they do say that the main focus needs to be that. They think a lot of the problem, at least where they are, can be solved by this. Does that give you pause to go, perhaps we need to take another look at that aspect of it?
Well, we're looking at that aspect for sure, and there's been lots of work done on setting up, command center on bed utilization. That's been happening for a little while. But certainly, when people are medically discharged and medically able to leave the hospital, getting them out of the hospital has been a challenge in some cases. So there's lots of reasons for that, but we're actively working on that. So, look, we'll continue to listen. We'll continue to act, and there'll be more to come. But the steps yesterday were very, very positive, and I think the letter also acknowledged that.
Practical effect do you think what you announced yesterday will mean on the ground in ERs across the province?
Well, I think patients will see a difference for sure. We recognize the need to communicate better with patients on what they can expect from the experience. And so that the patient advocate that'll be in the emergency rooms that's a real practical, obvious improvement that people will see and experience. The additional resources around the float program, practical addition of resources to the emergency rooms to help provide care to Nova Scotians. And look, you put these in line with the things that we've been working on for over a year, a number of initiatives. They all have an incremental impact on fixing the solution. There is no one single fix. And of course, as we make some change, then somebody will say, "What about this?" And that'll probably happen until the end of time. That's okay, because we'll keep addressing the what about this.
The actions require additional staff, and there's already challenges staffing a lot of positions. So where are we getting these people to fill these positions?
Other parts of the world, other parts of the country. We know recruiting is a challenge not only in Nova Scotia but nationally for sure. We have with the demographics of the province. There's an impact. People are retiring, people are leaving, people are changing professions or changing where they live, where they work. That's okay. That's happening. We have incredible demand, and we'll work hard to address that demand. We'll talk to the colleges on the licensing steps to make sure we can make that smooth. For the longer term, we'll talk to the schools about more can they shorten the training program without sacrificing the quality. So these aren't new challenges. These are challenges, and they're not unique to healthcare, and they're certainly not unique to Nova Scotia. But we'll recruit from wherever somebody wants to come and help in work in healthcare in this province.
These changes that were announced yesterday, I'm just wondering, at what cost do they come? Is there some budget implications? in terms of finances, how do we adjust for that?
Yeah, so look, I've always been very clear that addressing healthcare will cost money. It certainly is. We're making investments in healthcare, and we will continue to make investments. There will be more to come for sure. Making sure Nova Scotians have access to the care that they require. That's the driving point. We'll try to do that in the most cost-effective manner, but we won't be saying no to projects because it's going to cost money. So we're going to spend money. The specific investments announced yesterday in the tens of millions for sure, but we'll kind of we've got to kind of let it play out. We've authorized the additional resources for the emergency rooms, and then we'll see how that plays out. But the money is there to provide the care.
Figures, I mean, is that on top of what you budgeted already to spend?
Yeah, these will be incremental investments, and it's in the tens of millions, $10-20 million for sure.
I'm just wondering, is that on top of already budgeted?
Yeah,
Is this
that's
more?
right.
Okay,
Yeah.
all right.
I'm not sure you're aware, but the nurses union has also weighed in and suggests, Janet Hazelton says, and I'm reading from the release here, the union president says there isn't really anything immediate in the plan. She is worried about initiatives that risk adding to the workload of existing nurses if there isn't a significant shift in filling vacancies.
Disagree. There isn't anything immediate. Certainly there is. With the patient advocates, we try to get them in place this week, maybe this weekend. That's a new resource. That's immediate. Making funding available for the to expand the float program. That's new. That's immediate. So disagree that there's nothing immediate. Is there more work to be done? Of course there's more work to be done. Do we need to recruit nurses to this province? Of course we do. That hasn't changed in the last 10 years, and it probably, there'll always be a need to recruit. So disagree with the opening statements for sure.
Do you have any worries about what's happening with the Donkin mine? CBC had a story today listing, since they reopened in September, a long list of yet again safety violations. They seem to be chronic offenders here.
Yeah, we want to make sure that our mines are safe for Nova Scotians, for their employees. So there's a list of criteria that they have to meet, and certainly when we hear that criteria is not being met, we're concerned. We'll look at that, we'll investigate that, and I think the minister will probably have more to say on that. But we absolutely want to make sure that we have safe operators in this province.
But are you particularly concerned as Premier, given you're from an area where there was a major disaster? This is an underground mine, the only working one in the country, and it's susceptible to the same kind of problems that we may see in Westray.
I haven't seen the list of infractions, so so I don't really know the severity of them, so I wouldn't comment on it. But certainly the restart would we want to make sure it's a safe restart, and we'll be focused on that.
Can you come to a decision on the minimum wage recommendations?
No, not yet. The minister is still doing consultations with industry folks. The decision will be imminent. I think it's early February.
Go ahead. No, go ahead.
Yeah, Premier, the province has had recommendations on the teachers' pension plan since the summer. I understand there's still some talks going on between the province and the union about what to do, but a lot of time has passed. This is a thing that's been broken for many years. It's been sort of kicked around by the previous government several times. Are you going to kick this down the road, or are you going to deal with it?
No, I'm not really a kick down the road person, but we'll look at the funding status, as it stands, kind of in real time. It's the teachers' plan. I mean, impacts thousands of Nova Scotians. It impacts thousands of people who have, in many cases dedicated their life to educating our youth, which is really important and respected by the province, and certainly respected by me. So we'll continue to have those talks with the with the union and with other advisors to see what's the best way forward. But
Should Nova Scotians expect that they're going to be making a big contribution into this plan to get it back on its feet?
I don't want to presuppose the best way forward. I mean, we'll look at what's important for for the plan, but we'll look at what's important for Nova Scotians.
The last thing I want to ask about this is, any teacher who's retired after 2007 has no indexing. Those before have indexing. Is that a fair situation? Is that something that you'd like to rectify?
These are all discussions to be had. I mean, they would have been negotiated at some point in time by some prior government. So we'll look at what's in front of us, and we'll look at the best way forward. And if that's part of the negotiations, that's part of the negotiations. But the plan that's in place now is obviously something that's came out from prior negotiations, and prior, when the negotiations times come, we'll look at what's possible.
A couple of weeks ago, in response to questions from a colleague, you were talking about health funding for the feds. You said that you weren't in favor of kind of a province going it alone. One of the arguments that the Prime Minister has used not to move ahead with discussions about wanting to give the provinces more health funding is that there are provinces that are sitting on surpluses. Clearly not the case here in Nova Scotia. So why isn't it to our best interest to make that case to Ottawa on our own rather than waiting for, I guess, the Prime Minister to come to the table with all the premiers?
The best outcome for Nova Scotians is that the federal government funds its fair share of healthcare. That's the deal. That's the way it's supposed to be. That deal over time has shifted, and I believe it's time for the federal government to increase its funding of healthcare. So that's a national issue. I believe that the provinces have a stronger voice when they're unified on that, and that's kind of the approach. Funding is part of the healthcare discussion. There are other parts. We talk a lot about recruitment, so recruitment will require some cooperation with immigration. Also, technology is a big part of the future of healthcare. So, we could see some national leadership on that. But there's lots of moving parts on the funding. On the funding part of the equation, my interest is only for that for that of Nova Scotians, and I believe at this point in time that staying unified with the rest of the country, who has a similar interests, is the best position.
Is your position undermined by the fact that some provinces have surpluses?
My position has been undermined by the fact that the Prime Minister won't meet with the provinces. So hopefully the Prime Minister will sit down at some point with the premiers and we can have these discussions.
Put it another way then. Are you pushing a big rock up a steeper hill because other provinces have surpluses and we don't? We're clearly deficit spending.
That's a question for the federal government. If the federal government is looking for excuses to not fund their fair share of healthcare, I'm sure they can find a multitude of excuses. I'm not really interested in that. What I'm interested in is in the federal government being a fair funding partner to the provinces, especially.
Do you think that the Prime Minister is using that as an excuse?
Well, I mean, I don't want to ascribe motive, but you've indicated that it would be a reason. So I'm sure if you've indicated that, he might feel that too.
Okay, we'll go to the phone lines now. We've got Jennifer Henderson with the Halifax Examiner. Go ahead, Jen.
Hi, good afternoon, Premier. I want to ask about the quality review of the Cumberland ER death. I'm told that only the recommendations from this review will be forwarded to the family. And if that's the case, surely the family and even the public deserve more information about the circumstances of what went on. So can you tell us or commit to, to making public, the contents of that report while still safeguarding the privacy of the family and the healthcare caregivers? I think that's possible. We wouldn't need names, but we would certainly want to know the circumstances around what happened.
Well, thank you, Jennifer. That's not my understanding. My understanding is that the family would see the full report and have a full discussion of the findings of the review. So that's the first part. And the second part, we'll share what we what we possibly can on the findings of the review. We do have concerns around maintaining patient medical information, the privacy of that. So whatever we can share, we will share. My understanding at this point is that is at a minimum the recommendations. But if there's, look, we know the kind of the trauma this experience has caused for the family, the community, the people working in healthcare, and certainly the province, and in some degree at a national level. So we want to share what we can. That's our goal. But the family would have a full briefing and full discussion of the findings.
Okay.
Jen, do you have a
Thank you.
follow-up?
I just had, it's on a different topic, but I would like some clarity on this. I'm curious to know, with respect to the offer to buy the Lunenburg Foundry and Marine Railway, was that a cabinet decision to approve that offer?
Yeah, it would. A recommendation would have came through cabinet, I believe, and then there'd be like a full OIC if the transaction closes. But I think it's worth, like, this has been a subject of some discussion, and I guess my thoughts on it are as follows. Nova Scotia has a strong, proud shipbuilding history. And in this case, you have an asset, a shipbuilding asset, that's actually a railway going into the ocean. I don't know when you're ever going to be able to build another railway going into the ocean. That's going to be a pretty difficult thing. So when you have one, you should take the steps to preserve it if you believe in the industry. And when we look forward to the future, I believe we can have a strong shipbuilding industry in this province. So I think you should preserve what you have with an eye to the future, because once this is gone, you're probably never getting it back, and that's what that's about. For me, that's why I think making an offer on that was important.
The Premier has
There
time for
was a
one more
competing bid,
question.
though.
The Premier has time.
I'm not aware of any. Obviously, we wouldn't know what the competing bids were or anything. But what we saw was a strategic asset, a railway going into the ocean, and we didn't think that should disappear just right now.
Okay, we can do one more question in the room.
But you know now there is a competing bid. Your offer hasn't gone through. There's still time for you to say taxpayers don't need to put money into this. There is a bidder who's willing to run it as a shipyard, Mr. Brad Boudelier. So couldn't we not put the taxpayer on the hook for this?
I'm not that familiar with that. You may be a little more in tune with that, but I know that we made a bid. It was accepted. I wasn't aware of other bids. It's going through a due diligence process. So I mean that's the number of other bids. What those other bids were, I'm not too sure.
Okay, thank you very much.
Okay, thanks.